You can love your partner and still have absolutely no desire for sex. Welcome back to the Coffee Talk. I am drinking today chocolate mint protein coffee with 42 grams of protein. Today, we are talking about testosterone in women. Yes, women have testosterone too. Women naturally produce it through the ovaries and adrenal glands, just in smaller amounts. As those levels change, especially during perimenopause and menopause, after ovary removal, or because some certain medications, women may notice changes in sexual desire, arousal, strength, motivation, and overall well-being. One of the hardest things for a woman to admit is, I love my partner, but I do not want sex. That can create shame, confusion, and even tension in a relationship. Sometimes the issue is relational, but sometimes it's hormonal. Women should be able to discuss these changes without feeling embarrassed or judged. Why testosterone matters. It supports sexual desire and arousal, genital sensitivity, motivation and energy, muscle and bone health. Some women may notice reduced desire, difficulty becoming aroused, reduced sensitivity, and trouble reaching orgasm. But these symptoms may also be related to poor thyroid problems, poor sleep, stress, and medication side effects. Painful intercourse and vaginal dryness may be more related to declining estrogen. Estrogen, progesterone, and testosterone are all different. Some women may be prescribed estrogen and progesterone, but testosterone is never discussed. Estrogen may help with hot flashes and night sweats, vaginal dryness, and other menopausal symptoms, but progesterone helps to protect the uterus, and it also helps with sleep in some women. But estrogen and progesterone do not automatically improve sexual desire. A woman may say, my hot flashes are better, I am sleeping better, but I still have no desire. That deserves a thoughtful conversation. Women often use the phrase low libido to describe every sexual concern, but these concerns are different. They can have low desire, which is whether or not you're interested in intimacy. Arousal, which is how your body responds once intimacy begins. Comfort is whether or not intimacy is painful. Orgasm is your ability to reach climax and how satisfying it feels. A woman may still want intimacy but avoids it because intimacy hurts. That requires a different treatment than having no sexual desire at all. Testosterone therapy may be recommended when all other situations are proven negative. Women require much smaller doses than men. Testosterone may be given as a cream or gel, injection, or pellets. Creams and gels are commonly used because the dose can be adjusted or stopped more easily. Injections require careful dosing because it may create higher peaks and lower levels. Pellets release medication under the skin over the period of 3 months or so. Will testosterone make a woman masculine? Not necessarily, as long as it is not given in excessive doses. Side effects to testosterone: acne, oily skin, facial hair, hair thinning, and voice changes. But please be followed up by your primary care once you start treatment. So, how does testosterone affect women, and can it really be beneficial? Absolutely. It's game changer for some women. We do not have to age believing that you should be feeling exhausted, disconnected, uncomfortable, or unlike yourselves, and that's just simply how life has to be. A patient may say to me, my doctor told me I don't need testosterone. If your doctor has old-fashioned beliefs, just because they believe you do not need testosterone, is that necessarily true? Do your research. The literature says otherwise. Have you noticed changes in your energy, strength, sexual desire, or ability to feel like yourself? Comment hormones or schedule a hormone consultation with me so we can look at the complete picture and determine what your body may actually need.